Hi, this is Dr. Chan here today at Crown Dentistry. We've been getting a lot of questions about sedation dentistry, so that's what we're going to be talking about, and hopefully we can answer some of your questions. So sedation dentistry is something that we do for patients. They can have a number of things that they maybe are having a hard time dealing with. One of them is dental fear and anxiety. A lot of people come to us and they're either anxious or scared of some of the things that need to be done here in the dental office. Procedures, fillings, crowns, implants, extractions, root canals. Honestly, it doesn't really matter what the procedure is. Sometimes they just feel a little anxious or fearful, and so they need something to help them get through it. That's where sedation dentistry comes in. What it basically involves is us giving you as the patient either medication or laughing gas or some other things to basically decrease your awareness of the situation and to make things more comfortable for you. Like I said, there's a couple of different levels of sedation dentistry. The first level is laughing gas or nitrous. The next level would be oral conscious sedation, which involves giving you medications in pill form. We also do use laughing gas, nitrous oxide, in conjunction with that. The next level of sedation would be IV or intravenous sedation. That's where medication is injected directly into your bloodstream. And then sometimes that's also used in conjunction with oral conscious sedation and nitrous oxide. The highest level of sedation would be general anesthesia, similar to what you get in a hospital if you're going to get surgery, but we don't do that level of sedation here. We also don't do IV sedation here at Crown Dentistry. So what we do is we offer nitrous oxide and oral conscious sedation. But one of the great things about sedation dentistry is that, well, the medication that we use, one, it basically, I won't say that it puts you to sleep. It definitely can cause people to fall asleep for short periods, but then they're still aware enough that if we gently rouse them or give them a little shake, they're able to wake up again or kind of come out of their sedated state. So one thing is that it basically decreases your awareness of the surroundings, which is basically what you want, because if you're fearful or anxious of having dental procedures done, that makes it a lot easier for you. What is also awesome about sedation dentistry is that the medication that we use has the ability to cause some amnesia. So basically, you kind of don't remember what happened here when you were on the medication. A lot of times people will take the sedation medication and they'll remember coming to our office and kind of sitting down, and then the next thing they remember is either waking up in their car or at home in their bed, and kind of everything in the middle is kind of either fuzzy or they just flat out don't remember. And that's the whole point of sedation dentistry, is just to basically take the part that's maybe causing some fear and anxiety and just kind of putting it out of your mind. The first level of dental sedation would be the use of nitrous oxide, also called laughing gas. We'll use this as sort of an introduction sometimes for people who aren't really sure if they want to get into sedation dentistry, but they also want something that maybe can help them get through procedures. The nice thing about nitrous oxide is that it's relatively easy to use. You don't necessarily need a driver or someone to help transport you to and from the dental office. It goes on quickly and it also goes away quickly. All we need is maybe 10 to 15 minutes to get you on the nitrous oxide, and then when you're done with the procedure, we basically just have you breathe some oxygen, and pretty much the substance, the nitrous oxide, is out of your system, and you're able to just function normally again. The next level of sedation dentistry would be oral conscious sedation. That involves taking medication before you come into the office, and also when you're here at the office, we do give you more medication by mouth. And the nice thing about this is that it provides a deeper level of sedation, or basically getting you more comfortable while we're working on you and performing dental procedures. Also, it allows us to make it so that you don't remember what's going on here. There's a level of amnesia that the sedation medication imparts to you when you ingest it. You do need a driver to take you to and from the office when you're on this medication, because it's not safe for you to drive. So that is something that needs to be planned beforehand. The other levels of dental sedation we don't perform here in the office. Those are IV or intravenous sedation and general anesthesia. So those are performed by other practitioners sometimes, a lot of times Oral surgeons will use those when they do their procedures such as wisdom tooth extraction. We do not perform those levels of dental sedation here at Crown Dentistry. Sometimes people ask about oral conscious sedation and how that compares to general anesthesia. It's definitely safer for one thing. The level of sedation that we were trying to bring you to as a patient is much lower than with general anesthesia. Another big difference is that during oral conscious sedation, you're still breathing on your own. When you undergo general anesthesia, you're actually intubated and they have to breathe for you. There's machines and people monitoring you, such as an anesthesiologist. So that's with general anesthesia. With oral conscious sedation, you're still breathing on your own, and even though you may go in and out of sleep, you're definitely still taking care of your own breathing. Oral surgeons generally tend to use a combination of either IV sedation or general anesthesia. It kind of depends on the type of procedure that they're performing. A lot of times they're able to just inject medication into your bloodstream in order to get you to the level of sedation that they require. But definitely sometimes if the procedures dictate, they will also utilize general anesthesia. If you do intend to and decide to utilize oral conscious sedation to have work done, first of all, it's an excellent way to help monitor and manage your dental fear and anxiety. So you'll start by taking some medication the night before the procedure. Then the morning of the procedure, you'll take some more medication about an hour before. Then you'll have a companion drive you to our practice, and then we will get you into a wheelchair and get you out of the car. If you're too groggy, sometimes people are able to slowly walk into the office, even if they're a little groggy. But either way, we'll get you into the chair and we'll start you on some laughing gas. We'll get you comfortable and get you breathing the nitrous oxide so that it starts to relax you. Keep in mind, you also have that medication in your body, and that's starting to get you a little bit more sedated. Then once you're at a level of sedation that is comfortable for you, then we'll just start our procedure the way that we would normally do it if you were not sedated. I'll usually give some local anesthesia, just like I would for patients who weren't sedated, and then we'll just go ahead with the procedure. Depending on where your sedation level is, sometimes we'll give you more medication during the procedure in order to maintain that level of sedation that is comfortable for you. And then when everything's finished, we'll turn the oxygen on and flush the nitrous oxide out of your body. And then we'll also get you to a point of sedation where you're awake enough to safely leave our office. At that time, usually we have you get into a wheelchair and we'll bring you out to your car and get you into your car. And wherever your companion is, we usually give them some post-operative instructions on what to expect and how to take care of you and things like that. Sometimes people feel like when they get a tooth taken out, they want to be sedated. You definitely don't have to have sedation in order to get a tooth taken out. We routinely take teeth out with simply local anesthesia, just basically getting the area numb, but you're still at your normal level of consciousness. But if people feel like they're anxious or scared about that happening, we can definitely use dental sedation to help make that procedure go more smoothly and just make it easier for you as a patient. When people have dental sedation, I don't ever promise that they're going to fall asleep. That does sometimes happen when they're sedated. I would say, by and large, for the most part, when people do get dental sedation here in their office, they usually come in and out of sleep. Like they'll sleep for a little bit and then they'll kind of wake up a little and then they'll go back to sleep, and that kind of continues throughout the course of the procedure. Our most important goal when we're working with you under dental sedation is that you're comfortable, and if you need to be a little bit more sedated, we usually just give you as a patient a little bit more medication, get you to a place where you're comfortable, and then we continue the procedure. Everybody always wants to know if what we're working on, if it's going to be painful. I don't ever promise our patients that things are going to be pain-free here. I do my best, and I have our team do our best to make things as comfortable and as pain-free as possible. Sometimes there is a little bit of a discomfort, but we definitely do our best to make it as comfortable for you as a patient, for the patient as possible. I will say this, when people undergo dental sedation, it definitely makes them more comfortable, and it makes it a lot easier for us to deliver quote-unquote pain-free dentistry. So that is our goal. Sedation dentistry, thankfully, is a pretty safe treatment option. I would say the biggest things that we need to be aware of are your current health status and any current medical conditions and or medications that you might be taking. Just because when we're utilizing dental sedation in order to take care of you as a patient, we're going to be giving you different drugs and medications. That can definitely influence whatever is already in your body. Like if you're already taking different medications, then anything that we give you on top of that is going to have an effect. So we just need to make sure that there aren't any harmful drug-drug interactions and that everything that we're giving you is safe for you as a patient. If you feel like dental sedation is something that will help you get through either fear or anxiety, then we're definitely here to talk to you about the different options and whether or not dental sedation will be right for you. Please talk to any one of our staff and we can definitely set up that conversation. I hope we've been able to answer some of your questions today about sedation dentistry. If you have any more questions or if you're ready to act, please give our office a call at 916-285-9678. We're here to help.